Welcome to the Integrative Shift, reimagining the future of medicine with pioneers in the field. In this series, we explore doctors' journeys from allopathic medicine to integrative medicine and how it benefits their practice, their patients, and themselves.
Today we have the privilege of chatting to Dr. Renee Usdin.
She's a medical doctor and a homeopath, of course, a member of SASIM, also a board member of SASIM. And I'm curious to hear your story in your shift from purely allopathic medicine into integrative medicine, if you'd like to share.
Okay. Actually, for me, the shift came very early. While I was at med school, I loved the anatomy and the physiology and all of that. But I was seeing how they treated illness and thinking, no way, there has to be a better way than this. Like they would give you a treatment for one complaint. You get side effects, so they'd give you a treatment for the side effects, and then that would give you a side effect, so you'd be on something for the side effect of the side effect medicine, and it just, to me, was the most stupid way to treat any illness. So even at med school, I started learning first about indigenous herbs, and I trained with a herbal doctor in Natal, and then I started learning about European herbs, and then aromatherapy oils, which were like super concentrates, and that was all amazing. But then I finished med school and I went traveling. And while I was in Hong Kong, by a whole process of coincidence, I came to do an apprenticeship with an acupuncturist there. And suddenly, like, I was made aware that our bodies aren't just cells and physical beings, but actually we have a whole energetic field. And learning about the acupuncture points where you sort of key into those energetic fields and how you can move the energy and shift the energy. And this is like, oh my word, another whole experience. So I carried on traveling and learning more and more about energetic medicine. I came back here and I started studying with various different people. Franz Kromhout was one of the people that was a big influence for me. And learning about energetic medicine and how it works and how we can shift the energy body. And that was amazing. And then I came to open a practice. And my practice was a combination of natural and conventional medicine. But I found that I was still prescribing loads of antibiotics. No matter what I did, the herbal medicine didn't work quick enough. It was fantastic for chronic stuff, but for acute things like strep throats or tick bite fever or severe flu, the herbs work, but they take time. The acupuncture was better. It could work quicker, but I was still prescribing loads of antibiotics. And then I heard about a pharmacist, Ruth Bloch, who was teaching doctors how to do homeopathy. And I thought, wow, this sounds interesting. Let me give it a try. And I started studying with her and basically haven't stopped studying since. I trained with her for about 5 years, learning the basics of homeopathy. And then I did a course through the London School of Homeopathy for another 5 years. And I'm still studying because it's an endless learning curve. But what the homeopathy did for me was it gave me a tool that works on the physical and the energetic body. It's a kind of vibrational medicine. And it works fast and elegantly and minimal, no side effects really. And it's just such a beautiful, elegant system. And now if I prescribe 2 antibiotics a month, it's a lot. So that was quite a game changer in my practice.
So even for acute infections, it works, eh?
Amazing. Yeah, it's really, really incredible.
Interesting. I also studied with her.
Oh, okay.
Yeah. Fascinating.
Okay. Yeah, she was amazing.
Well, there's a perception out there that, oh, homeopathy is slow and it doesn't really work and all of this. It would be so great to put that myth to bed. Clearly, it works
Yeah,
even for acute infections and even emergency medicine
totally,
sometimes.
totally, and even for animals. So it is quite amazing. But the the principle of homeopathy is basically that like cures like. Whatever
Yeah,
can kill you in a tiny succussed dose can make you better. So the trick to homeopathy is to get the person's physical, mental, emotional picture as close a match to a remedy's physical, mental, emotional picture. And each remedy has that picture, a bit like your star sign. Each remedy has this profile. And the trick is to get the correlation as close as you can between the person and the remedy. So when people say about homeopathy not working, it's usually because the remedy is not the correct remedy. When you get that
absolutely.
right match, it's just incredible and it's quick. You know, the idea that homeopathy takes long is not true. You see results like almost immediately.
Yeah,
So obviously chronic illness, if you're giving low potencies, it can take longer. But for acute, it just works beautifully, shifts things within hours. But you've got
absolutely.
to get
And
the
it's
remedy
about
right.
getting the remedy right, eh? Because for
Yeah,
some
yeah,
ailments, there could be up to 200 remedies. So it's this whole holistic approach that you need to understand this person completely.
yeah,
Spiritual,
exactly.
mental, the whole lot, not just the physical
Yeah,
symptoms,
yeah. It's
which,
a whole
which
picture.
immediately is holistic medicine, isn't it?
Yeah, yeah. I mean, just the homeopathic interview, to find out what is the person's likes and dislikes. How do their body work? Do they metabolize quickly or slowly? What food do they like? It's so in depth and so individualized that the consultation itself is quite a therapeutic process. Just being, really, the patients being really, really listened to and heard, and their story, space for them to tell their story, and somebody that will listen and use it to benefit their health.
And the full person, including relationships, stress, all those little things that often
Exactly.
in maybe in allopathic medicine isn't given enough attention sometimes.
Yeah. Yeah, exactly.
So there wasn't one particular person or event that shifted you over. It seemed to me that it started really very early on.
Yeah. Yeah. It was really just an instinctive feeling that there was a better way to treat illness than what Western medicine could offer. And I
There
mean,
was
it's not to
more.
say that there are no uses to Western medicine, conventional medicine.
Yeah,
It's amazing in emergencies, in heart
yeah,
attacks, in motor vehicle accidents. It's like so
yeah.
got its place. But, it's so much more useful to have other tools in your toolkit that you can use before you use chemicals. So that chemicals, in a way, become your last resort. I think there's this thing in Chinese medicine where they say, first you use the herbs, then you use the needles, and only last do you use the poison. And so that's a principle that I kind of stick to quite well.
Yes, so basically there's just a much bigger toolbox. So you can still do
Exactly.
allopathic medicine and you have all these other tools as well.
Yeah.
So you must,
Yeah.
how does that impact on how you feel as a doctor?
What do you mean how I feel?
I mean, is that personally, it sounds like it's definitely empowering to the patients, but probably as a practitioner also.
Oh, yeah, absolutely. It's so beautiful to be able to look at a person holistically. It's lovely to have the medical knowledge because sometimes your first line is the chemicals. But it's
Yeah.
just beautiful to be able to have other tools that are gentle, that work with the body, that are elegant and beautiful. And that's so fulfilling for a practitioner to be able to use remedies that are really kind to the body rather than hitting it with a sledgehammer.
And so most of our members practice quite a few different modalities. What would you say is your top modality at the moment?
Definitely homeopathy is my favorite. It's
Yeah,
just really such a beautiful system of medicine. But I do a lot of lifestyle medicine. It's the basis of everything that I do. You
yeah.
know, we look at how you can shift your lifestyle just to support your health, maybe what vitamins and minerals and herbs you might need. I do a lot of referring for body work, so kinesiology or body stress release or chiropractors or osteopaths, because very often, even for an emotional problem, sometimes especially because of an emotional problem, you need to have body work and to be grounded in the body. So I use that a lot. And uh, another part of my practice that I really love is that I will look at what the illness is trying to tell you. It's almost like, well, every illness has some emotional or psychological or psychic um, meaning behind it. And it's your body's way of trying to wake you up and show you something. And until you listen to what your body's saying, you're never really going to shift the stuff. And sometimes even just acknowledging the emotions that are lying behind the illness is healing in itself. So that's another part of my practice that I really enjoy.
So if you were to chat to a doctor who is practicing pure allopathic medicine, what would you say as a top motivator for opening up a little bit more?
I would say, wouldn't you just love to have some other tools than antibiotics and anti-inflammatories and antidepressants and anti all these things? Like, wouldn't you just love to have an opportunity to use some medications that are soft and gentle and kind on the body and that really, really work, so that you are treating people ecologically sensitive in an ecologically sensitive way, in a soft, gentle way that's better for their body. And you have such a array of different modalities that you can use to treat, even when the medical world has nothing to offer. So
Yeah.
rather than just saying, well, there's nothing we can do for you, like there's so much you can reach out and learn about these different modalities that are amazing, where Western medicine doesn't have an answer.
And how has it impacted on you to be with SASIM and to attend the trainings and so on? Does that make a difference to your practice?
It makes such a difference. It's such a great support to have a like-minded community that are there, that are supportive, that are encouraging, that are so happy to share their knowledge. It's been such an amazing support for me to be part of that organization. I love it. It's amazing.
So people don't have to operate in isolation. There's always sharing happening across the
Exactly.
country. I think it's so
Yeah,
wonderful to have a kind and supportive community behind you. Huh?
definitely. 100%. Yeah.
And how do you see the future of integrative medicine in South Africa?
You know, I really think that it will become bigger and bigger as more doctors become aware of what it can actually offer and how it can benefit them to have some other tools in their toolkit. And I think also that as our ways of measuring outcomes or um, measuring the way medicines work, as that becomes more sophisticated and more clear, many more doctors will start to see the benefit in modalities that they thought, well, there's no scientific evidence. But there has not been scientific evidence, mainly because we haven't had the tools to measure. And I think the better we get at measuring those kind of imponderable, kind of, I won't say spiritual, but energetic and non-conventional methods, the better we get at measuring it, the easier it will be for people to start to use them. So I think it will be big. I think that it's the only way that medicine can really go, especially as our communities become more sick with blood pressure, with lipid problems, with chronic autoimmune things, doctors are going to have to start to say, okay, Western medicine is not cracking it at these things. What else can we use? What else is out there?
As we say, it's the future of medicine. Hey?
Exactly. I really think it is, for sure.
Yeah, I think so. Do you have any last message that you would like to share with potential doctors who might like to join?
I would just say, just take a chance, pick a modality, start using it, and just start to see what impact it has in your practice. And where the modality works for you, you will just be absolutely amazed, and you will find it expanding the reach of what you can do in your practice. So pick a modality, start to use it, start to work with it, and just see what opens up for you.
Absolutely. And you can also join SASIM as a student of integrative
Join
medicine
SASIM. Exactly.
and
Exactly.
attend
I
the
mean, what I
courses that
love
are
is,
available.
yeah. And what's so amazing, especially about SASIM, is having a WhatsApp group where you can put questions about things that are pressingly urgent for you to kind of resolve. And people really respond with ideas, with advice, with suggestions. And that has been like an invaluable support. So, yeah, it really is a community of caring folk.
Such a generous community. Hey? That for me
Yeah,
has been
yeah.
one of the best things about SASIM, that people were working in pockets on their own in the past, and now it's like one big
Mm.
network. And that for me is the
Yeah,
future, is connection, isn't it?
exactly. Totally.
Awesome. I think that's awesome. Is there anything else that you would have wanted to share?
No, I think that's good. Thank you for this
Thank
opportunity.
you so much. Thank you. Have a good evening.
You and you.
Bye.
Okay. Bye.